In a patient-centered medical home, what is the primary role of a medical assistant? And now if we look at this beginning part, in a patient-centered medical home, that's referring to like the primary care setting because it's considered a medical home because that's like their main provider they go to, but they also help refer them to other providers if needed, but they always kind of come back to their primary one to review anything that goes on when they see a specialist to discuss it. However, we actually could eliminate this part because it's really not relevant to the question. What the question really is focusing on here is the primary role of the medical assistant. And it's okay if you didn't identify that that's all you need to focus on and that this beginning part is not really relevant. How you can know that is just by looking at the choices. All of these are describing different responsibilities, and really regardless of which setting you're working in, whether you are in primary care or you're working in a specialist office, the role of the medical assistant really is the same regardless, and you will have the same answer choice that you will go with to this question regardless of if this said you're in an orthopedist office, because the role of the medical assistant stays. So let's look through the choices and see which one stays with the main idea of what a medical assistant is. So option A says participating in team-based patient care. And this seems like a good description of the medical assistant because you're part of the team and you're assisting in the care of the patient, and you do have your own sets of responsibilities that are involved in the patient care while working with other people who are also working in the office with you. So this looks like a good description of what the medical assistant does, and we'll go with this answer for now, but let's look through the other options. Option B says diagnosing medical conditions, and no, that would not be a responsibility of the medical assistant. The diagnosis would come from the provider, so either the physician, the nurse practitioner, physician assistant, whichever provider it is you're working with. Option C says billing and coding, and although you might actually be involved in the billing and coding, unless there is a biller or coder that's in your office, we want to focus on the primary role of the medical assistant. So if, let's say, you're meeting your friend and they say, oh, what do you do for work? And you say you're a medical assistant. And they say, oh, really? What is that? What does a medical assistant do? You probably would not be describing them as saying, oh, well, I handle the billing and coding for the patients. You would more likely say, oh, I participate on the team to provide patient care in the office. So therefore, we can eliminate option C. That doesn't fit what the question's asking. And then option D is like option B. It's saying prescribing medications, similar to diagnosing medical conditions. That would not be the role of the medical assistant. That will come from a provider. So we can eliminate that. And that leaves us with option A, participating in team-based patient care is the primary role of the medical assistant.